Dr. Wood, author of the book Miracles in Minutes. The title of this video is How Can Anxiety Be a Sign of a Brain and or Spinal Problem or Both? So let's talk about anxiety. Let's talk about fear, okay? We only have two core fears, the loud noises, and the other one is the fear of falling. I'm going to focus on the second one, the fear of falling, okay? So, why would we have a fear of falling? Because if we fell, we could strike our head, cause brain damage, and if the brain gets damaged, then it can shut down the entire body. You know, spinal cord injury, a brain injury, those things become permanent most of the time, and people are never the same. So the body's wired for balance, to stand up and not fall, okay? So what coordinates balance? There's several systems in the body that coordinate balance. One is your eyes, okay? It's your visual system. That's why people have poor balance. If they find a spot on the wall and they visualize, they can get balance. The other area is the inner ear, the vestibular system, the fluid system. If you close your eyes and lean your head to one side, you'll feel that you're falling to that side, and then the brain then tightens up muscles on the opposite side to pull you back upright. These are all functions of the brainstem and autonomic nervous system. The autonomic nervous system controls everything in your body. These are things that you don't think about, okay? And another one is proprioception, which is every cell, ligament, muscle, tendon, every bone and tissue in your body sends sensory information to your brain, and then motor signals come out. Motor is movement, okay? And the last part of the brain is the cerebellum, okay, which is for fine motor control. So how can you test and find out if you might have a cerebellar issue? Because if the cerebellum's off and one side of the cerebellum is working too much and the other side is not working off, you're unbalanced, and it'll show up in the body. So there's a couple things that you can do. One of the things, a simple test is you can check your hands. So put one hand over and you can check fine motor movement. This way, 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 this way. Okay? Then you can do the other side. This way, this way, this way, this way. In actuality, I have a problem with my left cerebellum. This is how I found this stuff out. Because I was having a lot of issues with hip pain, back pain, and all these things, and it wasn't getting better. And I'm like, what? And having a little bit of some stress and not feeling very comfortable in my body or content emotionally or physically, okay? Now, another thing you could do is stand up, or you could do pointing, you know, like touch your fingertip to your nose, touch your fingertip to your nose. If you miss, the side that you miss on is a problem with the cerebellum on that side, okay? And this is all doctor stuff. I'm not trying to turn you into a doctor, but I'm going to show you how you can evaluate your own brain and you can start to solve some of your own issues. That's the purpose of the book, Miracles in Minutes. You don't have to, I'm going to share with you stuff of learning how to help yourself from neuroscience and, some other things. You know, you still might need to go see a chiropractor and they can adjust one side of your body to stimulate the left. Let's suppose I have a left cerebellum issue. I go to pass point and I go, oh, I missed, okay? If they adjust just the left side of your body, it'll stimulate the left cerebellum and it'll start to balance that area out. There's some tricks to doing this, and you have to do some other exercises to start to balance it back out. But the easiest way to do it is to stand up, put your feet together, and you might want someone in the room with you to put their arms around you to make sure you don't fall over. Because some people, if they have a serious cerebellar issue or a serious issue going on in the brain or vestibular system, you could fall over. Okay, so you stand up, you put your feet together, okay, side by side, and then you close your eyes. And then you'll find out what happens. If you shift to the opposite side or to one side, there could be a serious cerebellar issue that's showing up. So now, if you close your eyes and you're starting to sway a little bit or you sway a lot, you're actually falling. You're falling. You're falling. And guess what the body's doing? It's always fighting to prevent the fall. I'm fighting to prevent the fall. I'm fighting to prevent the fall. So you're going to see some hypertonia. In other words, the muscles get really tight on one side. You know, Dr. Wood, this hip's always tight. This hip's always tight. This hip's always tight. This hip's always tight. because your brain is there's a problem in your brain and your spine, that your body is actually, the cerebellum is not firing on one side and your body's falling to one side. So you could get tight muscles. That could be one thing. I have a tight joint. I won't go away. I went to physical therapy. I did this. I did that. I did this. It's not getting better. I have anxiety. I don't know why. I'm just always anxious. What I tell you is one of the fears that's wired into the brain, the fear of falling. So if you close your eyes and you're leaning to the right, guess what you're doing? You're actually falling. And your body's always trying to prevent the fall. So how can you ever relax if you're always trying to prevent from falling over? It requires a lot of work, it requires a lot of energy, and it's going to make your brain go crazy. So an underlying sign of anxiety, it could be a problem in your cerebellum with your ability for motor control. Your handwriting could be off. It could be really sloppy. You could slur your words. You just can't seem to find words. I also check it in my office. I use the FMS, the functional movement screen, and what you could do is put someone on all fours on hands and knees like you're going to crawl, and then raise opposite arm and opposite leg. Then you can raise same side and same leg. Okay, so you're on all fours, on the ground, and then you raise one leg, the same leg and same arm, like right, okay, or right, left, like a cross crawl pattern. Now, if what I look for when I examine patients is I go, you're right from your left, and they go, yeah, I do. It's okay. So raise your right arm and left leg, and they sit and they think. I know there's a problem, because right here, the autonomic nervous system already knows you're right from your left. Babies didn't have to figure out right, left to crawl. They just crawled. That could be a sign that the vestibular system could be off, or there's a cerebellar issue. Mostly it could be a cerebellar issue. So if you stand up, you close your eyes, and you start to feel like you're swaying in space a lot, there's a cerebellar problem showing up right there. You could check, hands like this, like this. Or you can put them to the side like this and shake them, and one shakes easily and the other one's kind of like uncoordinated, then there's a cerebellar issue on that side. Some of the exercise that could be done, you have to be careful with these, okay, is, let's suppose I have a left cerebellar issue, which I do, is you'd follow your thumb out to the left as far as you can, that you can see, then close your eyes and bring it back to the center. You want to close your eyes when you bring it back, because you don't want to, if you follow it back to the right, you're going to stimulate the right cerebellar, so it didn't really get you where you want to go. You want to stimulate just going to the left, and that stimulates the left side of the cerebellum. You could do exercises just on the left side. That's going to stimulate the left cerebellum. Those seem semi-effective. What I go to is a early childhood movement called fundamental rolling. Okay, fundamental rolling is a baby learned how to roll over with just a weight shift and eye movement and reach, and they rolled over. You're not allowed to push. I mean, I don't have the space in here to show you fundamental rolling, but that's what I do. And then what I have patients do is I use a special band and I hook it up to their foot and their leg, and the band creates length in the spine, so it creates stability on one side, okay, and the other side rolls, okay. So it's like, think about geometry. There's a y-axis, there's an x-axis, and z is rotation. So the metaphor I use sometimes, and it's kind of funny, I said, if the stripper's on the pole and the pole's moving like this, she can't go around the pole because it's nothing to grab onto. So if you don't have good spinal stability going up this way, you're going to have a hard time creating a roll. Okay, so I use the band, and when I do corrective exercise, you're going to get adjusted first. We're going to find out what's going on. We're going to find out what's going on in your spine, check, upper cervical, check some other areas, and find out where you could have limited input into your brain that's not causing your cerebellum to fire on the left side. You would do something, it could be a roll, and then you'd go back. Sorry about that, I had a phone call come in. You're going to check feet together, eyes closed, and see if you're not falling as much. Okay, so if you don't feel like you're listening to one side as much, you know that this exercise is working for you. This is the whole concept of the book, Miracles in Minutes. I'm going to tell you from 21 years of clinical practice, you have to know how to do what needs to be done to correct the issue in the spine and the brain. You can't guess. How much do you dose, Dr. Wood? How much do you do? If you overstimulate and flood someone's brain, even though you're doing the right thing, you'll mess them up. If you don't do enough, it won't help. That's the conundrum. I was doing the right thing, but it still didn't work. Well, maybe you did too much of the right thing. You have to measure these things. And Miracles in Minutes, in the book, I teach you how to measure the dosage. It's specific per that person, per that condition. And this is why a lot of people don't get the healthcare result they want, because people are just shotgunning and throwing shit at you, and no one's checking where you are on the dose meter. If you overdose them, you'll screw them up, just like medication. You can do too much adjustment. You can do too much exercise. You need to find out what their metabolic capacity is. And you'll know that they'll move to a state of ease. They feel more relaxed. They feel more emotionally relaxed. You'll see their movement profile change. Movement profile change. So if you did opposite arm and opposite leg, and it was really hard for you to do that, and all of a sudden now it's really easy, and there's less thinking, that means something transpired in the brain that took effect. I recommend a 70% matrix, which is, I don't try to get someone 100% better, only to about 70%, but you may not be able to get to 70% today on that person just because their brain can only handle so much stimulus at one time. Okay? So I did a conversation the other day, and the question was, there's two people, okay? Each person walks 3 miles. One person walks 3 miles at one time. The other person walked 1 mile 3 times a day. Which one do you think had the better long-term results and the better outcome? It's the person who walked 3 miles 1 mile at a time. So it's like, are you better off to eat a big meal all at once and try to have your stomach digest it, or take the same meal and break it up to 3 separate meals? Which one's easier for the body to digest? 3 smaller meals than 1 big meal at a time. It's less stress on the body. So think about, if that's digestion, if you throw too much exercise at somebody at one time, it'll mess them up. Another metaphor, okay? Let's suppose you were the U.S. troops and you came upon the concentration camps in Nazi Germany, and these people have been starved to death. You can't feed them a steak. They look like they need to eat a steak. If you give them a steak, you'll kill them because it's too much. They're hungry as hell, but you can't give them a full dose of steak. You got to give them a little something. So when an area of the brain sometimes doesn't have a lot going on with it, then you can't feed too much exercise to them at one time. It'll mess them up. And that's what Miracles in Minutes is about. It's teaching people how to remove all the bullshit of thinking like, I did this exercise in the gym, Dr. Wood. Shouldn't I do the other side? Not if you have a cerebellar issue, because you'll do one thing and make it better. You'll do the other and you'll mess yourself back up again. And you'll never solve it because you didn't understand how the cerebellum works, which is the area of the brain. So it's Dr. Wood, and it helps to start explain. And if you start getting it right, you can get rid of anxiety, and you get rid of body pain. You get rid of like chronic back pain, chronic neck pain, because what was happening is your spine's lifting to one side, and it's always being creaked up. And the chronic neck pain or back pain you have is because you're out of alignment in one area. An area of the spine might need to be adjusted that's specific on just one side, and you can then do corrective exercise, and I like fundamental rolling. I've seen it work the best because there's a lot of research behind that, and even Feldenkrais technique, a person who was missing 2/3 of their cerebellum, they had them do some special rolling movement patterns, and you could rebuild the cerebellum and have the body do things, even missing a cerebellum. So if someone's missing 2/3 of their cerebellum, or if you have damage to your cerebellum, the good news is, due to neuroplasticity, the brain will rewire itself, make up new wiring, and neuroplasticity means creating new brain cells, because it does. And even though it looks like you're screwed, if you do the right exercise, your body can rebuild itself because it wants to heal you, because it loves you and wants to take care of you. So it's Dr. Wood, Learning How the Brain Works. My book, Miracles in Minutes, talks about how to help yourself, sharing some neurological caveats and things I learned from practice, and why maybe you can't get over anxiety, why you can't get over your chronic back pain, why you can't get over your chronic neck pain or chronic knee problem. You could have a cerebellar issue that's you didn't know about, and you do one thing to help yourself and something screws